As you can see here, our skeleton is made up of a lot of bones and cartilage. However, with increasing age, such complaints become more frequent. The first signs are sometimes mild pain in the joints after prolonged inactivity. I'm now bringing up keywords like osteoarthritis is curable, the osteoarthritis lie, but also prevention, preventing osteoarthritis. And we will now address exactly these points and topics. Pain with every movement or immediately when walking, so-called starting pain, even climbing stairs hurts in the knees. It's a thing with age, it may be getting stronger. With age, you gain a lot of life experience and also relaxation, but our body also shows us our limits again and again. Osteoarthritis is one of those diseases that can quickly put a real damper on our idea of eternal youth. Let me put it this way. If we get old enough, we will all get osteoarthritis. I will now tell you what you can do. Hello, my name is Dr. Tobias Weigel. With my YouTube channel, I would like to inform you medically understandable and correct about clinical pictures and symptoms, and also about the topic of nutrition and sports. Subscribe to my channel now so you don't miss anything. As you can see here, our skeleton is made up of a lot of bones and cartilage. We have from 206 to 214 bones, depending on how you count. In order for this entire apparatus to be mobile, we have joints that allow us to play the piano with our fingers, jump up with our ankles, or simply walk. As is so often the case, we only realize how important interaction is when it no longer works. Otherwise, we take it for granted. However, with increasing age, such complaints become more frequent. A reason to take a closer look at osteoarthritis. Yes, you can have osteoarthritis at a young age, but it is a typical condition at an advanced age. What exactly is osteoarthritis? To understand osteoarthritis, we need to take a closer look at the bones. Here, for example, the pelvis and hip bones of a human being. For most of us, movement in the shell works perfectly, and we can move painlessly and more or less quickly. In order for this movement to run smoothly in the truest sense of the word, we need so-called shock absorbers. If we just rubbed bone to bone, something like that, we would have pain with every step and we would only be able to walk unevenly or not at all, and then it would create a vicious cycle. I'll get to that in a moment. The cartilage around each bone forms these shock absorbers. It absorbs shocks and ensures that you don't feel any pain when running. It's a shock absorber, so to speak. As we age, we often lose cartilage mass, which leads to problems with the affected joints. To stay with the image of a shock absorber, the shock absorber in a car also gets old at some point, and then the car rattles when it has to drive through potholes. And in humans, these potholes are theoretically every single step that our bones have to cope with somehow. Or another example to understand osteoarthritis. Your joint, the cartilage, is like a car tire, and over time the tire tread decreases more and more until at some point you are driving on the rim. That means bone rubs on bone. And to say that osteoarthritis is a lie is definitely wrong in the truest sense of the word. There is osteoarthritis. And at the latest, when the profile is worn out, healing of the osteoarthritis is no longer possible. Then it will be too late. But I'll go back to what we can do preventatively in a moment. That is very important. Prevent osteoarthritis. Briefly about the causes, you often hear that it's overweight, but it's not that simple. Deformities such as knock knees are just as typical as overloads. Very important keyword that you never want to hear: lack of exercise and being overweight. In the case of obesity, the greatly increased fat cells release various hormones, for example cytokines, which have the potential to trigger an inflammatory process in the joints. Leptin, which is produced in abdominal fat, influences inflammatory reactions and bone metabolism. There is evidence of a damaging effect on cartilage tissue, particularly in the knee joints. That's why being overweight is bad for the joints. Not only because your weight presses on them, but also because of the production of these hormones, which also damage the joint, so to speak. What are the symptoms of osteoarthritis? About the symptoms. It is therefore not particularly surprising if progressive osteoarthritis causes increasingly severe symptoms. The first signs are slight pain in the joints after prolonged inactivity. For example, if you take a long break, sit on the sofa, are in bed at night, then get up in the morning, or as I said, sit in an armchair for a long time, then it is difficult at first to take a few steps. You have startup pain. There is occasional and short-term pain in the affected joints. However, this can also occur the other way around. If we put too much strain on ourselves for too long, then overload pain can also occur, startup pain, overexertion pain. What's particularly bad about this is that the physical exertion required to do this continues to decrease over time. We are forced to become increasingly inactive and sit around all the time. This is very bad for our bodies, but also for our heads. I explained that in this video, but that is also bad for the cartilage, especially this inaction. Because the cartilage, this shock absorber in between, is not supplied by blood vessels, but rather by exerting pressure on this cartilage. The toxins and waste products are then squeezed out of the cartilage, so to speak. And when the pressure eases again, new substances, nutrients, etc. are absorbed. It is absorbed, which is very important to know. That is why movement is very important for the cartilage. In the advanced stage, the pain occurs not only when we exert too much strain or have not moved for too long, but almost constantly, sometimes even at night. All movements of the joint hurt, and we are more or less forced into inactivity, and inactivity makes the problem worse. I just explained it with the cartilage. Even if we keep the joint completely still, pain can still occur. This is a really heavy burden for those affected. For pain patients, it is often the pain-free phases that naturally give us strength again. And the longer or the fewer periods we have without pain, the more difficult it becomes. But the pain also leads to other problems. When we have joint pain, it is natural that we try to take special care of this joint. At first, it feels like a relief to us. Sure, we relieve it in the acute moment. Eventually, the pain will subside through the rest and we can even be a little more active again. In the long term, however, this often leads to the surrounding joints or body parts being incorrectly loaded. For example, if you put less strain on the left knee or leg, you put more strain on the right one, so to speak, and over time this will wear out more. So the problem shifts for a short time, but then, understandably, it occurs at both points, which we see very often. You first have osteoarthritis in one joint, knee joint for example, and then also in the other. I'll illustrate this here using the skeleton. If we assume that the hip is damaged by osteoarthritis, then this ultimately affects our entire musculoskeletal system. We hold the affected leg differently and automatically put more or less strain on the knee and ankle. At the same time, the other leg is also influenced when it absorbs part of the load. If we now look at the entire pelvis, we can immediately see that a different position of the pelvis also has an upward effect. The spine then becomes crooked and in turn causes further pain or restricted movement. These are precisely the challenges that you often have, that you also feel the pain elsewhere. As osteoarthritis progresses, there are progressively increasing restrictions on movement and, above all, instability of the entire body, which in the majority of older people also brings with it a high risk of falling. And anyone who has ever experienced this knows that such falls are of course no laughing matter for elderly people. Keyword, for example, fracture of the femoral neck. Another point, one often speaks of so-called activated osteoarthritis. This is also important to know. Deactivation is sometimes possible for a few weeks to months, even without therapy. And sometimes you take some miracle cure, perhaps from the internet, and suddenly realize that you have no pain for a few days or weeks. This could simply be deactivated osteoarthritis and actually has nothing to do with the juice or the pill you took, which joints can be affected. In principle, all joints are more or less susceptible to osteoarthritis. The greater the strain on the joint, the higher the risk of osteoarthritis. And that's why these areas, knee and hip joint arthrosis, are particularly widespread. Knee joint arthrosis is also known as gonarthrosis. In the case of hip joint arthrosis, congenital misalignment of the hip can also help trigger early joint problems. That's why we always do the U examination on children and babies. This is used to check whether there is a so-called hip dysplasia. And if that's the case, then you get a pair of spreader pants, for example, so that the hip goes into the joint properly and it forms correctly. However, osteoarthritis can also occur further up, for example, in the hands or shoulders. The hands are particularly stressed by the ever-increasing amount of work on the PC, as in the saddle joint, for example. Every typing and every keystroke typically acts like a shock to our cartilage. And I had just given the example of the shock absorber through the road where you drive over it, and this ultimately ensures that the risk of complaints on the fingers increases. Of course, a healthy or unhealthy sitting posture can also lead to this. So make sure you have a good sitting posture and ergonomic keyboards. They can help a lot, but we'll get to that in more detail in a moment. How is osteoarthritis treated? Unfortunately, treating osteoarthritis often only means curbing further progression. Often we can only treat the symptoms, not the cause, especially when it's advanced. Osteoarthritis cannot be cured or reversed. We can often only make sure that it doesn't get worse, that it is stopped. Depending on which joint is affected, there are various options available to us doctors. Of course, we can relieve the pain and combat the inflammation in the joints with medication. Typically, NSAIDs are given, ibuprofen, diclofenac. We can also surgically replace a joint or completely stiffen it, for example, so that it no longer causes any problems. What is much more important, however, and this is the focus, is that we find the reason for the osteoarthritis and do something about it. Excessive body weight often places above average strain on the joints. I said fatty tissue. The problem with hormones, it can therefore make sense to lose weight here. Since exercise therapy or sport can help with osteoarthritis, we have a good measure here to support the joint with more muscles and relieve the pain. But not every sport is suitable for this, you have to know that. For example, swimming and cycling are very good. In this display, you can see all the muscle strands that enable our movement, but at the same time also relieve the strain on the joints. And these muscles should be strengthened. There are many other measures such as insoles, relief splints, tips, or walking sticks that prevent one-sided strain. In order to relieve the pain directly, Exercise therapy is often combined with other treatments such as hydrotherapy, massages, and ultrasound. In this case, whatever helps is good for you. So listen to your body and look for possibilities yourself. How can I prevent osteoarthritis? Osteoarthritis is a disease that cannot be reversed or cured. I just said that. We should therefore do everything we can to prevent them at all costs. Of course, the best way to do this is to reduce the load on the joints. You don't always want to hear that, but it's very important. Weight loss and regular non-excessive exercise protect against poor posture and allow muscles to grow. Very important, excessive exercise, regular marathon running, for example, is of course also bad. It's just like that. To come back to this, being overweight increases the risk of osteoarthritis. Swimming, cycling, yoga, these are sports that are super joint friendly. That again as a tip. We can also make sure to treat our knees or back as gently as possible, to stress them by lifting correctly, and to avoid activities that put strain on the joints in everyday life or at work. Prevention also includes paying attention to the first symptoms. So if your back or hips keep pinching, take the discomfort seriously. Think about that startup pain I just explained. Osteoarthritis that is discovered early causes significantly less pain over the next few years than one that goes undetected if you start taking measures early. As soon as your joints feel unstable or your movements are only functioning to a limited extent, you should definitely think about visiting a doctor and having them check out what the problems are. Because one thing is certain, osteoarthritis doesn't go away on its own. It doesn't just go away, and it can actually get worse if you ignore it and try to endure it and tell yourself it's not that bad. That's why you should definitely counteract it at an early stage. But sometimes you have to say that it has a lot to do with genetics and there may not be much you can do about it. But the minimum is always, or very important, keep moving, because this is important for the joints and for the cartilage, as I explained earlier. Thank you very much and stay loyal to me.